Thank you all for joining us here tonight with such short notice. Know that we would not be doing an urgent briefing like this unless it was necessary and critically important for the people of Newfoundland and Labrador. With that, I'll turn things over immediately to Dr. Fitzgerald.
Thank you, Premier. Good evening, everyone, and thank you for joining us. We've called this emergency briefing tonight to inform you that we have received confirmation that the outbreak in the metro area is indeed due to a COVID-19 variant of concern, specifically the B117 variant, which was first recognized in the UK. This variant is more infectious than the original strain of SARS-CoV-2, and we've seen how rapidly it has spread in facilities and elsewhere in the country. We know that if not controlled, it becomes the predominant strain within weeks of first appearance. This is concerning and serious, but we have the ability to overcome it. We know that public health measures work against this virus, even variants of concern. We have seen non-epidemiologically linked cases in other areas of the province, and we have seen how rapidly this variant spreads. We know that our greatest ally is speed. We therefore have to take quick and decisive action to reduce the spread of this variant. To that end, I am announcing that effective immediately, I'm introducing special measures orders across the province that will take us back to alert level 5. We will reevaluate this measure in 2 weeks. This is necessary to give public health the time it needs to expand testing and to actively find cases. It gives us time to plan our response. I understand this is not welcome news. We have to remember, however, that we have the ability to control the spread of this variant. Remember our tried and true public health measures. Keep your contacts as low as possible. Maintain physical distancing. Wash your hands often and well. Wear a mask when interacting with anyone outside of your household bubble, even briefly. Stay at home if you are unwell, even if your symptoms are mild. And arrange testing if you have symptoms. Now is the time for all of us to pull together, to be supportive, to be safe, and to be kind. Hold fast, Newfoundland and Labrador. Thank you.
Thank you, Dr. Fitzgerald. As your Premier, I can't stress to you enough the urgent nature of this situation. My one and only concern right now is the safety of the people of our province. As doctors, we know too well what this variant of COVID-19 can do. I want to reassure you that Dr. Fitzgerald, Dr. Haggie, and I, as well as every member of your government, will do everything we can to contain this spread and to protect you and your family, our seniors and the most vulnerable, all of us. I just spoke with Prime Minister Trudeau, and he has offered whatever support we may need at this critical time. I urge you to listen to Dr. Fitzgerald's public health advice. She has guided us through tough situations before, and we will get through this one as well. Newfoundlanders and Labradorians are resilient people. Please download the COVID-19 app if you haven't already, and please stay safe. We need to remain kind and calm. I'll now turn it over to Minister Haggie for some brief comments.
Thank you very much, Premier. This is, in all the history of this pandemic, 11 months old, the first time that I can recall doing 2 briefings in the space of less than 12 hours. The key here is that speed, as Dr. Fitzgerald says, has been important, and this information is less than 2 hours old in our department. Public health works. We know that. Dr. Fitzgerald has repeated that, and we've seen that in other jurisdictions. So the guidelines need to be followed. The special measures orders need to be adhered to as strictly as possible, both in the letter of them and in the spirit of them. And the third piece is that our vaccine rollout will proceed as promptly as we can, and that, of course, is contingent really now on the delivery schedule, which is somewhat out of our hands. I'm sure there are a lot of questions There is a dearth of answers, maybe, but we'll certainly try to deal with those. And with that, Premier, I'll hand it back to yourself.
Well, thank you, Minister. I'll now open it up for questions from the media.
Thank you, Premier. For the benefit of our speakers, there are 8 reporters registered for today's call. The question and answer session will be conducted in 2 rounds, where each reporter will have the opportunity to ask 1 question and 1 follow-up per round. Following this, I will ask each reporter if they have 1 final question. Our first questions are from Peter Jackson with The Telegram. Please go ahead.
My apologies. Dr. Fitzgerald, you have said in the past that the appearance of a COVID variant would not really change your approach much to containing this disease. Has your position changed on that?
No, our approach to containing the disease is to do what needs to be done proportional to the degree of risk, and I feel that's what we've done here today.
Okay. A question, I guess, for the Premier. I'm assuming this means that the election is cancelled tomorrow.
My primary focus right now is on the health and safety of every Newfoundlander and Labradorian. I haven't given much thought to the election. Presumably, Mr. Chalk will update the public as appropriate.
Thank you.
Our next questions are from Sarah Smelly with the Canadian Press. Please go ahead.
Hi there. What would you say to someone out there who's feeling really scared about this news right now?
I think we need to remember that, I mean, this is concerning. There's no doubt about it. We have seen how quickly this has spread in the metro area. You know, if we look at our epi curve, it's almost a straight line up right now, and that is concerning. So I can't really sugarcoat this for anybody, but what we have to remember is that we have the means to control it. We know that these public health measures will work against this variant just as it would work against any variant of COVID-19. So I think, you know, we really need to remember that. We need to focus on those. We need to do what we need to do to protect ourselves, to stay home as much as possible, stay within your bubble. You know, just to go outside for walks and things like that, absolutely, but really make sure that you're limiting those contacts as much as possible until we can get out there, we can do that case finding, we can do that testing and find cases and get people isolated as need be, and really see what the situation is out there, because we know that there can be asymptomatic carriage of this virus just like with any other strain of COVID. So we want to find those cases. So this gives us time to find those cases.
Just to...
and I just want... Oh, sorry.
Sorry, I was just going to echo, and please follow Dr. Fitzgerald's advice. Remain calm, and we have gotten through, you know, an event before. Following Dr. Fitzgerald's tried and true approach, we will get through this one as well.
Thank you. And I wonder, does knowing now that the source of this outbreak comes from this variant, does it explain? Does it answer questions for you? Does it explain, for example, why it was so easily transmitted?
Absolutely. It certainly explains. I mean, we clearly had some kind of, you know, significant spreading event over this past weekend. I hesitate to call it a super spreader event, but we certainly had, because we may have had several smaller events, but we certainly had significant spread over this weekend, and it spread quite easily and quite rapidly through you know, the high school. So I think this certainly confirms what a lot of us were perhaps suspecting, but not really wanting to admit. But, you know, it is what it is now.
Thank you. Thank you very much.
Our next questions are from Kellyanne Roberts with NTV. Please go ahead.
Thank you. Do we know how many cases of the variant are in the province right now?
So as many as new cases that we've had since the 5th of February, they're probably all variant. Certainly we've sent We sent 31 specimens to the lab from the beginning of January, specimens collected from the beginning of January. After February 5th, all of the samples that were sent were this variant. So that was 19 samples. Now, obviously, that's the samples that we sent, but we have to assume that this is what's circulating right now, and for the next, for the foreseeable future anyway, we have to assume that any cases we get are this variant.
Thank you. And as public health works through this, I know it's been a shock for a lot of people to hear this news this evening. Knowing we're going back to alert level 5, that feels like 5 years ago at this point. Can you walk us through some of those guidelines again? Is essentially everything closed except for grocery stores and pharmacies and the hospital?
Yeah, so the special measures orders will be coming out a little bit later. I have to be honest with you, we were moving at breakneck speed here, so I honestly don't want to go into all of the orders for fear that I might actually say something wrong, because you're right, it does feel like 10 years or 5 years ago, Kellyanne. So the order will be up on the website hopefully shortly after this session, and the information is still there on the website. See, isn't it a good thing that we didn't change the website?
Thank you.
Our next questions are from Peter Cowan with CBC. Please go ahead.
Thank you. Unfortunately, the website has crashed because I think everyone's busy trying to figure out exactly what alert level 5 means. For individuals who are trying to now figure out what does my weekend look like, what should I be doing or not doing, what's your advice?
So at this point, stay in your bubble. We will maintain that if you're in a single household bubble that you can join with one other bubble, but you need to be consistent with that. Like, it has to be one bubble that you join with and that's it. We're back here for a little while. I'm hopeful that we will not have to lock down like we did previously, that, we've learned a lot since then. And I think we can certainly be a little more measured in how long it will take us to make decisions about, coming out of this alert level. But we really do have to get back there and just think like we did back last April. Stick to your bubble. Only go out for essentials. All of those. Wear your mask. We didn't have masks back last time we were in alert level 5, but now we'll wear our masks, and hopefully all of these measures will reduce the spread, help us get a handle on this very quickly.
Initially, we had a 2-week circuit breaker that was brought in order to try and bring this under control. The fact that this is a variant, do you expect that'll change the time frame that we'll be able to get our case levels back down to where they were?
It depends on how much spread has happened prior to us finding out about it and getting those measures in place. I feel that we probably got a couple of days jump on it more than we would have because of the advisory that we put out with regard to the restaurant, and that sort of brought forward people. We found some cases, I think, sooner than we would have if we had to wait for people to become symptomatic. So I'm hopeful that we got a little bit of a jump on it that way. But I guess time will tell.
Thank you.
Our next questions are from Richard Duggan with BOCM. Please go ahead.
Thank you. Premier Fury, you mentioned a phone conversation with Prime Minister Justin Trudeau a little while ago. I was wondering if you tell us more about what was said there and what some of the support that the province is looking for from the federal government here.
Well, as soon as I got off the phone with Dr. Fitzgerald, I reached out to the Prime Minister and we discussed the fact that the variant was here in the province and was largely responsible, if not fully responsible, for the spread that we're seeing. And so he assured me that the Government of Canada was primarily focused on the people of Newfoundland and Labrador supporting us should we require it. We discussed different potentials in the future should they be needed, like extra support for contact tracers and other options should they be required. I had a follow-up conversation with Minister LeBlanc to that effect as well, and the Government of Canada is here to help if it is required.
Okay, and the virus getting into Indigenous communities has been of particular concern throughout the entirety of the pandemic. Given the seriousness of this situation now, have we reached out to any Indigenous leaders about this situation, and what was said?
We are scheduling a call with all Indigenous leaders either tonight or tomorrow morning, is my understanding. This is all happening. This is all happening at, to use Dr. Fitzgerald's words, at breakneck speed. So you'll have to forgive us if we haven't talked to everybody before informing the public.
Thank you.
Our next questions are from Ross Lord with Global News. Please go ahead.
So considering that you've now confirmed the bulk, if not all of these new cases are the result of the variant first identified in the UK, do you have any particular concern about activities outside of the Avalon this weekend? By that I mean the rest of the province, which is still going out to vote tomorrow.
So these measures apply across the province. Alert level 5 will apply across the province, not just for the metro area.
Okay, so please connect the dots for me here. I may have missed it. What does that mean for the voting tomorrow elsewhere in the province?
I'll have to refer that question to Elections NL, I guess.
Our next questions are from Roger Bill with iPolitics. Please go ahead.
Premier Fury, as soon as you got off the phone with Dr. Fitzgerald, you said you called the Prime Minister, then Mr. LeBlanc. Did you call Mr. Chalk, or did somebody else in your office call Mr. Chalk, or has Mr. Chalk been advised, and when was that?
No one in my office has discussed anything with Mr. Chalk. I understand Dr. Fitzgerald did have a brief conversation with him to update him, but as I said from the beginning, it's not appropriate for any political party to try to influence the person running the democratic process.
And just another question to follow up. After Dr. Fitzgerald presented said what the briefing was about tonight, you spoke about yourself and Dr. Haggie and Dr. Fitzgerald as doctors, and then you went on to say, as in any member of your government, you were assuring people that every member of your government is on this for you. Why didn't you say every member of the legislature?
Because there is no legislature right now. It's suspended, but there is still a cabinet and a premier as per normal parliamentary procedure.
Well, why do you say every member that you voted for? I'm sorry, I asked my follow-up.
Our next questions are from Patrick Butler with Radio Canada. Please go ahead.
Dr. Fitzgerald, in your opinion as Chief Medical Officer of Health, is it safe to hold elections outside the Avalon Peninsula tomorrow?
So I have spoken with Mr. Chalk. I've given him my advice from a public health point of view. I do not think it will be prudent for me to speak about that until Mr. Chalk has had an opportunity to address it.
Can I ask why?
Because it's not my news to tell.
And Elections NL is in charge of elections. And we want to, this is a serious briefing tonight with serious new information. So we need to try to keep it directed towards public health advice. Again, this is all happening in real time and live time. So I understand there's questions about the elections, and I understand that,
Which, to be quite frank, Mr. Premier, are very serious questions
I
as
understand.
well, which is why it's important for journalists to ask them.
No, I totally understand, but we don't have the answers. Mr. Chalk is governing the election.
Our next questions are from Peter Jackson with The Telegram. Please go ahead.
I am curious about some of the measures that may be coming in. For example, are there any changes to border rules because of this?
Sorry, what, Peter? Border rules.
Border rules.
Those are all things we will be looking at. We certainly have the travel restrictions in place that we've always had in place, and the isolation isolation measures will still apply. We're we're looking at how we need to adapt our approach at this point. Our focus right now is to prevent the spread. The variant is already here, so our focus right now is to prevent the spread across the island and into Labrador. So we certainly are focusing our efforts there right now. The border measures that we have will stand, and will be, but anything is on the table over the next 24 to 48 hours.
Okay, thank you. And a question for Minister Haggie. I'm wondering whether we already have a backlog that still exists to some extent from medical procedures being put on hold last spring. How do you feel this is going to affect that kind of backlog?
It's likely to increase it, quite frankly, Peter. My understanding is that it is quite likely within the next 24 hours there will be significant changes to planned procedures within Eastern Health, and there will be discussions around the same kind of thing across the province, given the fact that Dr. Fitzgerald has put us back to alert level 5. So I would expect that will have an impact. When we were in alert level 5 the last time, we did not cancel chemotherapy, we did not cancel cancer-related surgery, and we did not interfere with emergency work, unlike some jurisdictions which had to do that. I don't envisage us going that far.
Thank you.
Our next questions are from Sarah Smelly with the Canadian Press. Please go ahead.
Has our case count gone up since the briefing this afternoon?
To the best of my knowledge, just before I came over here, we had, now I've got it forgotten, 19 cases?
Nine.
9 cases, sorry, 9 cases since the media briefing this afternoon.
Okay. And how unique is our situation? Are there other examples that we can look to?
Certainly, I mean, the UK, the variant has been, the predominant strain in the UK for quite some time. So that's been what's been circulating there. We've had outbreaks elsewhere in the country. We had an outbreak in Ontario. We know that there have been variants of concern and probably community spread of variants in other jurisdictions as well. So. We will be reaching out to our partners across the country to find out all the information we can to see how best to respond to this variant and to get things under control.
Thank you.
Our next questions are from Kellyanne Roberts with NTV. Please go ahead.
Dr. Fitzgerald, can you tell us a bit more about this variant? For a lot of people, this is the first time they're hearing about the BB1. How quickly does it transmit? What extra precautions should we be taking against it?
So we know that it can spread quite rapidly. We've seen it spread very rapidly through long-term care facilities. We know that within families, it often affects, the original strain of this affected, for most people, 2 to 3 people will get infected from the virus. So if you had the virus, you could infect 2 to 3 more people. And often in families, we didn't see it spread within a household. Like some people in the household may not have gotten it, depending on how close their contacts were. We do know that with this virus, it doesn't take very close contact at all to spread it. And so that's why we have to be very careful. So that's why we have to be extra vigilant with our public health measures, such as physical distancing, wearing our masks, all of that. Absolutely.
And we've seen studies on the vaccine across the world at this point when it comes to variants, but are we still expecting the vaccine to be effective against the BB1?
Yes, to the best of our knowledge right now, this vaccine is still effective against the B117 variant. So that is certainly what we're going with at this point.
Thank you.
Our Our next questions are from Peter Cowan with CBC. Please go ahead.
We've seen in some other jurisdictions the advice changing. For example, telling people to double mask because of new variants, or increasing physical distancing because they know that, for example, 6 feet may not be enough to prevent spread. Are we going to be changing any of those recommendations and measures that we have right now?
So as I said, everything's on the table. We're certainly looking at all the latest information to decide what we have to do. This is evolving even at the national level in our conversations on those special advisory committee meetings. So, I suspect that there will be some changes in our case and contact tracing and other public health measures as well.
And for people who may be listening to this who have tested positive and may be concerned about this, if someone does get this new strain, how is it different for them from a health point of view?
So, I mean, as far as we know right now, the majority of cases we're seeing, especially in young people, it seems to be in the same way as the original variant, milder. A lot of people don't have symptoms and can spread it still, which is why another reason why it spreads so effectively. But as with any of the as with the original strain, age is certainly a risk factor. So the older we are, the greater the risk of more severe disease. So that's why it's really important for us to protect our vulnerable populations. This is a new entity. We're still learning about it. As we get more of that information, things may have to change. But, as I've said from the beginning, we will evolve as we need to.
Thank you.
Our next questions are from Richard Duggan with VOCM. Please go ahead.
Thank you very much. Will we be ramping up our testing in the metro area in any way? You just mentioned that a lot of people don't have symptoms with this new variant, so are we going to be ramping up our testing in order to find more cases of it in any way?
Yep, certainly that's part of our plan, is to increase testing. And we know that we have to be active in finding these cases. So, this is an opportunity for us to use our rapid testing and our PanBio kits, and we certainly will be using those to help us look in areas where we have suspect cases, where we might see, we feel we might see more cases. So we do have plans to roll that out. We just, we need to make sure we're using them effectively, that they're giving us the information that we need, that the information we're getting is reliable. So it's not just as simple as going out and doing testing, because every test we have has a different sensitivity, it has a different specificity, and we need to make sure we're using the right test in the right place at the right time.
Thank you. And for Dr. Haggie, obviously the demand for testing is going to take a very sharp turn. How confident are you that we have enough tests and equipment to handle that surge in demand?
Certainly from the point of view of the rapid test kits, I think the rapid antigen test kits, we have somewhere of the order of 120 to 130,000 in-house. The ID now, I think it's of the order of 18,000, and the capacity of the PCR is not yet exceeded. So we have discussed with the federal supply chain about whether or not we need further kits and how rapidly we can get them, and those discussions continue. But for the moment, for the immediate short to medium term, we think we can cope with even a significant increased demand.
Thank you.
Our next questions are from Ross Lord with Global News. Please go ahead.
Okay. I wonder if you've been in touch with provinces, including Nova Scotia, which had isolated cases of the variant first identified in the UK and the one first identified in South Africa, and have not had an outbreak, in hopes of maybe comparing notes that may inform your own method?
As I said, this is all relatively new, so we've reached out to the Public Health Agency, and right now, but no, I haven't really reached out to any of my colleagues across the country at this point. We will be, absolutely. We've got, there are lots of lessons to learn from other areas, and we've been doing that from the beginning. We've all been learning from each other, so, we'll continue to do that.
And follow up if I can. As the top doctor in the province, you said you gave Mr. Chalk advice. I know it's sort of the elephant in the room now, I think. Do you anticipate him making a statement within the next little while here?
I really don't know what Mr. Chalk is going to do.
We would certainly hope and expect that Elections NL gives an update on what the status of tomorrow and the future is with how they will run an election given this serious situation.
Thank you.
Our next questions are from Roger Bill with iPolitics. Please go ahead.
Premier Fear, I'd like to go back to the question I raised on the first round.
Sure.
You were, nobody doubts that you view this as critically important. I'm not suggesting that at all. I'm just suggesting that your choice of the words, they are government, as opposed to some of the choice of words.
Sure.
You're the candidate for Humber Gross Morin, and unless the election is canceled, there's a vote tomorrow. I mean, Kelly LeDuc, the political scientist at MUN, thinks you've put yourself in an impossible position.
Well, as I said before, and is correct, the province still has a premier and a cabinet, and I think it's important, given the seriousness of this situation, that we be here. And that, as you have pointed out before, that may be a disadvantage, but sometimes that the disadvantages and advantages come with the job.
Well, I didn't suggest it would be a disadvantage. I just wondered if it would be. But I'll pass to the next, my next colleague.
Our next questions are from Patrick Butler with Radio Canada. Please go ahead.
Dr. Fitzgerald, a few times I think everybody on this call has mentioned that it's a rapidly evolving situation. Just trying to get a sense of when did you actually find out that that these cases are linked to the new variant? How long ago did you learn this news?
We found this out. I'm not exactly sure the time, to be honest with you, but like within the last 2 to 3 hours.
And do we have any idea of how the variant got to the island of Newfoundland?
No, we still haven't found that out yet.
Thank you.
I will now go back through each reporter to see if you have one final question. Peter Jackson with the Telegram. Do you have a final question?
Sorry, no, I don't. Thank you.
Thank you, Peter. Sarah Smelly with the Canadian Press. Do you have a final question?
No, I'm good. Thank you very much.
Thank you, Sarah. Kellyanne Roberts with NTV. Do you have a final question?
Yes, it's essentially a double-headed question. But with this variant here, is it likely that we will see other variants? And does this variant make people more sick? Are we expecting an increase in hospitalization?
So, the chance of seeing another variant is completely independent of the fact that we have this variant. So, we could see at any time another variant, yes, absolutely. The information about hospitalization certainly is, there's still there's ongoing study about that. I'm not sure that the evidence is really quite clear at this point. But, obviously that won't change what we have to do. We do know that any virus that spreads more quickly and can infect more people can still make more people sick enough to be in hospital. So even if it doesn't cause more severe disease, just by the mere fact that it's causing more disease can mean that it's causing more hospitalizations, right? So those are things we have to think about, and that's why it's so important that we all carry through with these public health measures like we've outlined, and really stick to these measures to keep this under control.
Thank you.
Thank you, Kellyanne. Peter Cowan with CBC. Do you have a final question?
I do, and it's about travel restrictions. We saw concerns from leaders in Labrador. They'd like everyone who arrives in Labrador to get essentially entry-level testing because they're concerned about the virus spreading into their community. So is that under discussion, and are you looking at actually implementing hard controls rather than just voluntary, only come if it's essential, in order to try and reduce movement between areas so that places that haven't seen the virus don't see it?
Yeah, so certainly those conversations are happening, and we hope to be able to meet with Indigenous leaders and with our Labrador Grenfell Health to be able to discuss just what we need to do.
Thanks.
Thanks, Peter. Richard Duggan with VOCM. Do you have a final question?
Yes, Dr. Haggie, healthcare worker burnout was a concern, especially when we were in alert level 5 last spring, and we've heard some pretty serious stories from other areas that have been really hardly hit. This news will undoubtedly have a lot of healthcare workers in the province on edge. What's your message to them tonight, and what contingency plans do we have in place to protect them and prevent burnout?
Those are very good questions. Certainly, the strain of COVID has weighed heavily on the healthcare providers, be they in the community or within hospitals. I think we can help by some changes in work, and we've referenced some of the alteration to hospital admissions and ambulatory care, which will allow them more time to be freed up for inpatients and, if need be, for COVID patients. We do have extensive employee and family assistance programs within the regional health authorities to provide support. And of course, like any other member of the public, they have access to bridgethegap.ca, and they also have access to doorways. We speak with the unions from time to time, and this will obviously be a subject that they would bring up too, and I'd be interested in any suggestions they might have.
Thank you.
Thank you, Richard. Ross Lord from Global News. Do you have a final question?
My questions are all waiting for someone else. Thank you.
Thank you, Ross. Roger Bill from iPolitics. Do you have a final question?
No, but I want to thank Dr. Haggie and Dr. Fury and Dr. Fitzgerald. Thank you very much.
Thanks, Roger.
Good luck.
Thank you.
Thank you.
You're welcome.
Thank you, Roger. Patrick Butler with Radio Canada. Do you have a final question?
I do. It's a two-parter. Fury, first of all, in your call with Prime Minister Trudeau, was there talk of additional aid from Health Canada or from federal authorities, given the nature of the situation right now? And Dr. Fitzgerald, given the contagious nature of this variant, are there added measures going to be taken in the health system to protect hospitals and clinics, places like that?
So I'll start. Thanks for the question, Patrick. The Prime Minister and I talked about different options available for the Government of Canada to support the people of Newfoundland and Labrador, including contact tracers, additional personnel if required. And Dr. Fitzgerald and I have not fully spoken about that, just very briefly about what that would look like, when it would be required. But most importantly, he gave the assurance to the people of the province that the Government of Canada was here to support if required.
And with respect to hospitals and healthcare, certainly, we've increased restrictions with regard to visitation, and we will be. My understanding is that the RHAs are looking at that as well. So these are all things that that have been put in place before, and we will do it again. With regard to exactly what's happening in the RHAs, that's a little, veers a little bit out of my scope. That tends to be taken care of by acute care. So I don't know if the Minister has anything to add there.
No, I think we've referenced some of the potential changes that would come about to hospital and acute care operations. The exact details of those will be worked out over the next 24 hours, and as they become available, they'll be published through PSAs or the like.
Thank you, everyone. Premier, do you have any final comments?
Well, thank you, everyone, for joining us on such short notice. I know we didn't have all the answers that everyone required, but we're doing our best to provide the most up-to-date information that we have on such a critical situation for the people of the province. Please trust Dr. Fitzgerald and the experts. Follow her advice. I want to in particular thank all the frontline workers, including the nurses, the doctors, the grocery store attendants, everyone who's on the front lines as essential workers. I know that this news must cause some anxiety in you and your families, and we all feel that. Myself, Dr. Fitzgerald, and Dr. Haggie, we all feel that. But we know that you are valued, you're important, and together we will get through all of this as we have before. So please stay calm and kind.
Thank you, Premier. Stay safe, everyone. Take care of yourselves and each other, and enjoy the rest of your evening.
Our smartphones. We use them to keep in touch, to play, and to work. Now, your smartphone can help you limit the spread of COVID-19. Someone can have COVID-19 and not know it. They can spread the disease before they have any symptoms. The Government of Canada has developed an app that will let you know if you may have been in contact with someone who has tested positive for COVID-19. The COVID Alert app creates a random code so that no one will know your name or your location. The app uses Bluetooth to exchange random codes with nearby phones. The code is a randomly generated string of digits and letters that changes every 5 minutes, so it cannot be used to identify you. The app does not have access to your name or address, or your phone's contacts, your location, or your health information. If someone you've encountered later tests positive for COVID-19 and uploads to the app a one-time key they received from their healthcare authority, you'll be notified that you may have been exposed. If you test positive for COVID-19, you can upload your one-time key from your healthcare authority. The app will then notify the people you've encountered without revealing your identity. You can then take steps to limit the spread of the disease. If you know you've been exposed, you should contact your local public health authority and follow their instructions. Using the app is one more thing we can all do to help limit the spread of COVID-19, in addition to washing our hands, keeping 2 meters apart, and wearing a non-medical mask or face covering when it's difficult to maintain physical distancing. You can do your part by downloading the app today and helping others use it too. The more people who use the app, the better we can contain COVID-19. Help protect yourself and your community. Download the COVID Alert app to help limit the spread of COVID-19. Go to the App Store or Google Play. Find out more at canada.ca/coronavirus. A message from the Government of Canada.
We now return to our regular programming already in progress.
Yes.
Yeah.
Something else.
Mm-hmm. Oh, that's a great story, because most times people wonder, why did you stay in Newfoundland? Because you were heading out to Ottawa. People come and they finish their program and they leave. So we now know that you stayed. Okay. And you're a successful entrepreneur as well. And I know the famous International Food and Craft Fair, and I will take my containers when I will make sure that it's on my calendar, take my food containers, so I'll have enough for the week. But how was that? And just tell us a little bit about that business.
The International Food and Craft Fair actually started when I was the event coordinator for the Multicultural Women's Organization. Okay. So then we were having International Food and Craft Fair at the Holiday Inn. Right. I started working as their coordinator in 2006. So it grew very fast that we were having the International Food and Craft Fair, not only in St. John's at the Holiday Inn, but we also got funding from ECOWA, that's the federal government through ECOWA, and the provincial government. So we were having it at the Holiday Inn, we were having it in Ganda, we were having it in Cornerbrook. We were actually planning to do it in Happy Valley, Goose Bay, because I even went there to do like background research, survey, to find out if it would be feasible for us to have the International Food and Craft Fair in Happy Valley, Goose Bay, but it was kind of far away. We didn't say no, but then because it was growing so fast, expanding, they decided to stop it. So as usual, I seem to be a grabber. I said, okay, instead of us abandoning this event that is so important, maybe I would take over and register it as a business, as an incorporated business. So that was how I took over the International Food and Craft Fair, registered it as International Food and Craft Expo. So instead of going back to Cornerbrook, because we were in Cornerbrook from 2009 to 2012, every year we'll go to Cornerbrook and have the event. We'll go to Ganda, the same thing. So when I took over, I just limited it to having it at the Holiday Inn in St. John's, but I also introduced one in Paradise and in CBS in Kelligrews. So from 2012, we were having it in these 3 locations until last year, and now COVID-19.
But it seems like everything you put your hands to grows bigger and it becomes successful.
The support of the community, because as we do with Tombolo, I also use the same approach. So whether in like now International Food and Craft Expo, whether in St. John's or Paradise or Kelligrews, that's covering CBS. We work with the town council. So that's how people tend to kind of very supportive in a way.
Well, I always believe in collaboration to get what you want done. But now it takes my mind back to April 2014 when we heard that from the state, Borno State, where you were born, that almost 300 girls mainly were kidnapped from their school. What did you think, like those days following the news when you heard it?
I felt I had mixed emotions. I felt very sad and very guilty. Guilt in the sense that here I am here in Canada, I am safe. I don't have to be afraid of being kidnapped or being killed. So I felt very guilty. And prior to the kidnapping of the girls, because Boko Haram started in 2009. So 2014 was probably the last straw. They say that the thing that really made many people globally to say, okay, this has gone too far. So when I had it, prior to that, we were sending money quietly with my husband because my brother-in-law, he's a church minister. So they had, in their church environment alone, up to 300 refugees just sleeping outside. So we'll send money so they could buy food and cook for these refugees in their camp. But when we heard that 300 girls were kidnapped and a lot of towns and villages were taken over by the militants, I was really sad and I felt, as I said, guilty. So I spoke with our church minister because I was on the vestry, St. Augustine's Anglican Church. Our minister then was Reverend David Pille. So I told him, I said, I need more prayers because we've been praying. I said, I need more prayers. He said, what happened? I said, about 300 girls were kidnapped in a high school in Chibok in Borno State, where I came from. And he knew already because, you know, we've been praying, but I told him about the kidnapping. So he said, okay, what can we do? I said, pray. He said, no, praying alone will not be enough. So he said, maybe we should do some fundraising. So I went home, thought about it, discussed with my husband. I said, maybe the best thing is to create like a non-profit organization because we can't be grabbing money without accounting for it. So my husband said, yeah, I think it's better. So we registered it as We Care Foundation of Newfoundland and Labrador. with the federal government, and then also as non-profit, incorporated non-profit, not charity immediately, because you have to go through some process application. So it was non-profit. So with that, we were able to fundraise. So what we did was we will create multicultural concert and dinner. Okay. So we sell tickets, and the event will take place in the church basement, right. St. Augustus Anglican Church. Okay. And then the church members were amazing. Sometimes I'll cry. You see an elderly woman in her 70s will come and put $5 in my hand, and then I'll start crying. I say, these people, they care so much. But we wanted to do something so that people can eat or be entertained rather than giving donations like that, you know. Yeah. So we started this fundraising through concerts, or we created cafe, and I've delivered food in so many offices here and people's homes in the winter, and people were very sad, but I enjoyed it. So that's how we raised money. And we went. What we did here, we created the board members. We had a meeting, created like a scholarship application, sent them to refugee camps, because I already had colleagues, you know, in the University of Maiduguri and other places. So what we did was we started identifying some girls in refugee camps. So we awarded the first one 11 girls from 3 states, because it affected Borno, Yobe, and Adamawa. So we got them, the parents agreed, so we put them in school.